Step 5, decrease your body's inflammation. So let's talk about inflammation associated with painful conditions. This picture demonstrates how prevalent inflammation is in all of the different painful conditions that we all deal with. Anywhere from trauma to aging to different lifestyle activities to other things like immune system problems or GI problems. Every one of these types of pain conditions have inflammation as the core. Most people don't understand that diabetes, cancer, cardiovascular disease, and even Alzheimer's disease, all of these have inflammation as one of the main components of how these things progress. And so if we start knocking down the inflammation that is in your body, then we can reverse every one of these things and get you back into a more healthy state. The chronic inflammation of pulmonary diseases, such as asthma and chronic obstructive pulmonary disease, all are based on the activity levels, but they can also have the chronic inflammation be reduced by working on their lifestyle, working and having more whole foods in your diet, using specific nutrition like fish oils. All of these things can be helpful to knock down the chronic inflammatory process that leads to all of these pulmonary diseases. Of course, one of the most classic examples of chronic inflammation is seen in arthritis. When you have chronic inflammation, it makes the arthritis process get worse. But there again, doing the right things, eating the right foods, having the right attitude, moving more, and having a greater lifestyle will allow you to decrease the amount of inflammation and keep the arthritis in check. The final area that chronic inflammation has a huge impact is in the autoimmune diseases and in the neurological diseases. Because when you have chronic inflammation, you create fire in your immune response and it becomes overactive, leading to an autoimmune disease. And also in the neurological diseases, that same fire that is created by chronic inflammation causes increase in the amount of cells and proteins that are produced that leads to cognitive decline, brain function decline, and leads to a lot of these neurological diseases. So in the first 4 steps, we've talked a lot about inflammation already. But in step 5, we're going to get specific into the different types of inflammation and then what you can do right now to help decrease that inflammation. So let's start by talking about the acute inflammatory response. Some of the most common things that will trigger an acute inflammatory response are infections, tissue trauma, tumor growth, or any kind of immune disorder. When any of these acute triggers occur, a local reaction occurs within the tissues, and then the white blood cells are activated and they release a chemical called cytokines. We will be talking a lot about cytokines because cytokines are one of the 3 different types of inflammatory fluids that create the inflammatory response. The first thing that they do is they create a systemic reaction. And what that means is that it increases the size of the arteries and veins and puts more blood and more white blood cells into the area of inflammation. This causes a fever. Also, what cytokines do is increases the cortisol production. Cortisol, if you remember, is your stress hormone. It also increases the liver's production of proteins into the blood so that then those proteins can come and heal the tissue that has just been damaged. And then finally, cytokines increase the proliferation or the production of white blood cells into the blood so it can also come to that area and heal the area that has just been damaged. So if everything goes well in the acute inflammatory response, normal healing occurs and acute proteins return back to their normal levels. But if chronic inflammation and infection occur, then this acute inflammatory response continues and the cycle goes on, which leads to further problems down the road. Your body basically makes a decision after the acute inflammation to either be resolved or to turn chronic. And so this is when you have to have the right environment within your body to make sure that you have full resolution. So when an injury or an invading organism or infections occur, there's chemical mediators that are protective in nature that create that acute inflammatory response. And in the ideal situation, this acute inflammation becomes self-limiting and leads to full resolution. If acute inflammation continues and it is not stopped and it is not self-limiting, it can lead to abscess formation, wound healing and scarring, and organ fibrosis, which is another name for organ scarring. This can lead to diabetes, cardiovascular diseases, or asthma. Other classic examples of chronic inflammation that occur because the acute inflammation was not self-limiting are periodontal disease, which is another name for gum disease, and rheumatoid arthritis. Here is a different way to look at the inflammatory cycle. The first picture on the left is looking at a number of white blood cells and how each of these different white blood cells go in and take care of what they need to take care of in the acute inflammation response, and then over time they fall off and get back into normal. So as you can see in the purple graph, the edema, which is the swelling, is a very short period of time. Then the second wave of white blood cells, called neutrophils, come in and they help to heal and get rid of the debris from the cells that were injured and died during the first acute inflammation. And then finally, the green graph is looking at what's called the monocytes, or the macrophages. These cells actually come in and mop up the rest of the debris and take care of the rest of the inflammation and infection, so that then there is a complete resolution to this entire process. On the right-hand side, this is another example of how acute inflammation can become chronic inflammation. If you don't have enough of what's called lipid mediator class switches, which is another way to say fish oil, then your body will not have enough activity to allow for complete resolution. If you don't have enough of the fish oils in your body, then your acute inflammation fails and it can lead to chronic inflammation. Now let's look at the inflammatory cycle when you are on painkillers. Painkillers like aspirin have been around for 120 years, or since 1897. And then the other non-steroidal anti-inflammatory drugs have been around since the 1950s. But what happens to the inflammatory cycle when you are taking these types of drugs? As you now know, there's 3 phases to the inflammatory cycle. The first phase is that when you have edema or swelling, The second phase is when you have the neutrophils come in and start to heal the tissues. And then the third phase is when you have the monocytes or the macrophages come in and clean up all the debris and resolve the entire inflammatory cycle. But if you continually use the painkillers or the non-steroidal anti-inflammatory drugs as you are working through the inflammatory cycle, what happens is the monocytes or the macrophages are never fully engaged in this inflammation cycle process. And so what happens is things aren't cleaned up correctly, things aren't laid down correctly for the new tissue, and this can lead to chronic inflammation. So really, the chronic use of these non-steroidal anti-inflammatory drugs when you're going through this inflammation cycle can actually lead to chronic inflammation down the road. So we keep talking about chronic inflammation, but why is chronic inflammation so bad? Chronic inflammation is associated with many different disease processes. Chronic inflammation is associated with cardiovascular disease, including heart failure, stroke, cardiomyopathy, which is another name for muscle of the heart problems, arterial sclerosis, which is hardening of the arteries, and heart failure. Chronic inflammation is also associated with different kinds of cancer: lung, kidney, stomach, colon, pancreatic, and also lymphoma. Chronic inflammatory disorders such as IBS, pancreatitis, psoriasis, and COPD, or chronic obstructive pulmonary disease, are also associated with chronic inflammation. Diabetic complications such as cardiovascular disease, neuropathy, nephropathy, sepsis, which is when your blood becomes infected, and retinopathy, which means that there is a problem with the retina within your eye, are all also associated with chronic inflammation. Metabolic disorders such as fatty liver disease, heart disease, type 2 diabetes, and metabolic syndrome are also associated with chronic inflammation. Of course, chronic inflammation is also associated with chronic pain disorders such as fibromyalgia, osteoarthritis, rheumatoid arthritis, and also degenerative joint disease. Most people don't realize that chronic inflammation is also associated with mental health disorders such as depression, bipolar disorder, and schizophrenia. And chronic inflammation also plays a main role in neurological disorders such as Parkinson's and Alzheimer's disease and dementia. So let's look at the big picture with inflammatory conditions. When there is tissue damage or injury, there is an initial defense mechanism that occurs. And this is your immune response, both your innate immunity and your acquired immunity. Your innate immunity has 4 different parts, and the first part is simply cell death. Every cell in your body has a suicide switch, if you want to put it that way, that if something happens and it gets infected, it will die. The second part of your innate immunity is your stomach acid and your digestive enzymes. If an invader comes into your stomach and into your digestive system, the acid and the enzymes are designed to kill it. The third part of your innate immunity is your skin. Your skin has an immune system all of its own and allows for your invaders not to get into our body. And then the final part of your innate immunity is natural killer white blood cells. These are circulating throughout your entire body and are just ready, willing, and able to take care of problems when they occur. But now let's say that you have this tissue damage or injury, and there is acquired or congenital deficiencies or defects in the immune response, either it being through your innate immune response not working correctly or your acquired immune response not working correctly. This is where problems of inflammation start to compound and get worse. Of course, your body is going to do everything it can to stay into balance. But if you have an altered immune response, then you start to have immune system imbalances, and that leads to chronic inflammation down the road. So if tissue damage or injury leads to an altered initial defense mechanism, or there is deficiencies or defects in the immune response, which leads to an altered immune response, this all leads to chronic inflammatory disease, such as autoimmune disease, cardiovascular disease, gastrointestinal or GI diseases, musculoskeletal problems, and even cancer. All of these chronic inflammatory conditions cause pain. The causes of pain in chronic inflammation can come from many different sources. The first source can be a temperature difference. If you have chronic inflammation, it increases the temperature of the tissues and can lead to irritation of the pain fibers. Another cause of pain in chronic inflammation, it comes from compression and shearing of the joint surfaces. When you have chronic musculoskeletal problems or chronic joint issues, there is an increase in swelling, which causes compression of the nerves and can cause shearing of the joint surfaces on each other and leads to irritation and pain. Another extremely common cause of pain in chronic inflammation is overuse. We've all done it. It is, you've done too much in one day, you've made your muscles sore, you've made your joints sore, you've made them swell more than they usually do, which leads to disability over the next couple of days. Another extremely common cause of pain in chronic inflammation is infection. This really comes into play in the digestive tract when you have an imbalance of your good bugs, the bad bugs, or when you have the blood starts to have bacteria in it and it starts to create infections within the joints, or even infections within the brain. So infections are something all of us have to look at and understand that we have to keep under control, because if we don't keep infections throughout our entire body under control, chronic inflammation can never be overcome. Another cause of chronic pain and inflammation is toxicity. When you have extra toxins that have been built up in your system over your lifetime, it is extremely irritating to your joints, your tissues, your glands. So making sure that we can keep the toxic load that you currently have under control and decrease that toxic load over time is extremely important and will reduce your pain over time. So as you can tell, chronic inflammation causes pain. Our job in this program is to do everything we can to look at all of the different areas of chronic inflammation and work on each one of them specifically so that the pain is reduced, your chronic inflammation is reduced, and your lifespan can equal your health span. So now that you understand how the inflammatory cascade works, what are some of the triggers of the immune response and inflammation? One of the most common triggers of the immune response and gets the inflammation going is a term that I call tissue stress. And tissue stress occurs when your diet has a lot of what's called oxidized fats in it. Oxidized fats are another way to say polyunsaturated fats. The most common polyunsaturated fats are corn oil, vegetable oil. These fats have never been seen in nature except for the last about 100 years. And they are never been designed to be taken into your body. But over the last 100 years, we have all done that. And what that does is it increases your immune response and causes chronic inflammation. Another very common trigger to the immune response and chronic inflammation is psychological stress. When your body undergoes consistent, continuous psychological stress, it leads to chronic inflammation not only of the brain, but of the rest of your body. We've talked a lot already about how injury triggers the immune response and inflammation, but the next area that is really important that we haven't really touched on too much is how food and environmental allergens can also trigger the immune response and cause chronic inflammation. Your diet is extremely important because it is where the digestive function and your immune response meet. We'll be talking a lot more about the immune triggers of viral infections and how it is really important in decreasing the chronic inflammation as we go throughout this entire program. But right now, what you need to understand is that viruses are one of the main causes of people not getting healthy and staying healthy. The last immune trigger we'll talk about right now is nutrient deficiencies or a poor diet. As you well know, your diet and the amount of nutrients that you bring into your body are extremely important for your overall health. But they're even more important in how your immune response is triggered and how much inflammation you are going to carry around in your body. So let's look at the difference between acute and chronic inflammation. We've already discussed a lot of the causes of acute inflammation. They're either some sort of an infection or tissues get injured. And the major cells involved in acute inflammation are your neutrophils, your monocytes, and your macrophages, which are all of your white blood cells. Then the primary mediators, or the things that create and cause the acute inflammation, are called vasoactive amines and eicosanoids. These are chemicals that go into the tissues, allow for dilatation or a widening of the arteries so that the white blood cells can come in and do their work. The onset of acute inflammation, of course, is immediately. And the duration of that acute inflammation should only be about a few days. And then finally, the outcome of acute inflammation should be resolution, scar formation, or if it is not resolved correctly, chronic inflammation. The most common causes of chronic inflammation include a persistent acute inflammation from infections, from foreign bodies, or from an autoimmune reaction. The major cells involved in chronic inflammation are the monocytes, the macrophages, the lymphocytes, plasma cells, and fibroblasts. These last two cells, the plasma cells and the fibroblasts, are part of the acquired immune system, not the innate immune system like we were talking about earlier. The primary mediators or the primary drivers of chronic inflammation are called Th2 cytokines, there's growth factors, there's something called reactive oxidative species, and what's called hydrolytic enzymes. All of these substances are there to fuel this chronic inflammation. And sometimes it's necessary, but most of the time it's not. Then the onset, of course, of chronic inflammation is delayed for days or weeks after the first acute inflammation has occurred. And the duration of chronic inflammation can be many months or years or forever. So our job is to do everything we can to decrease that chronic inflammation. And finally, the outcome of that chronic inflammation is tissue destruction, fibrosis or scarring, or even cell death. Chronic inflammation leads to obesity. Chronic inflammation affects all of the microcirculation of the organs and tissues of the body and leads to obesity over time. The inflammatory blood markers that are commonly found in obese patients include your increase in CRP or C-reactive protein levels. This is the specific blood marker for inflammation on a normal blood panel. Another common inflammatory blood marker found in obese patients is an increase in your insulin level. When you have an increase in your insulin level, this will lead over time to diabetes type 2. Going right along with an increase in your insulin level, there will also be an increase in your blood sugar level, which is another inflammatory blood marker found in obese people. When your blood sugar and insulin levels continue to rise, this is a sure sign that your body is becoming extremely inflamed. Another inflammatory blood marker commonly found with obese patients is an increase in your leptin level. Leptin is a hormone that is not usually looked at, but if it is looked at in your blood work, it will be increased most of the time, because if you have an increase in your insulin level, almost always you will have an increase in your leptin level. Leptin is a hormone that is produced by the fat cells in the body. Its main role is to regulate how many calories we eat and burn, as well as how much fat we carry on our bodies. So really, the easy way to think about inflammation and obesity: the larger your waist, the more significant amount of inflammation that you have in your body. And when you become inflamed and obese, you create an autoimmune response that is triggered by your fat cells. And those fat cells are mistaken as intruders by your immune system. And as those fat cells are attacked and expand, the white blood cells come in and clean up, but release even more inflammatory chemicals. And these inflammatory chemicals are the primary regulators of the immune response, and then that in turn increases that inflammation even more. And this is why obesity and inflammation are linked, and produces a 10 to 35% increase in the amount of inflammatory chemicals in a resting obese person as compared to somebody who is not obese. So how is inflammation tied to the digestive system? There is definitely a gut bacteria thyroid connection, and about 20% of the T4 is converted to T3 in your gastrointestinal tract. So if you do not have a healthy gut flora or good bugs, this conversion is reduced dramatically. Inflammation also increases the amount of cortisol, which is your main adrenal hormone, which also decreases the amount of active T3, which is a thyroid hormone. And while it increases the inactive T3, there is something called reverse T3 and T3. And the reverse T3 is increased when there is an increase in the cortisol. So all of these things work hand in hand with each other to increase the inflammation and decrease the amount of thyroid productivity. So to simplify as much as possible, when you have low thyroid hormones, it increases inflammation, it increases immune dysregulation, and it also increases the leaky gut problem that you have in your digestive tract. When you increase the inflammation, it can lead to low thyroid hormone production, it can lead to immune dysregulation, and also contribute to a leaky gut problem. When you have a leaky gut, it can increase the amount of inflammation that is there. It can increase the amount of immune dysregulation that is going on in your body. And over time, those two things can lead to low thyroid hormone production. And chronic inflammation also leads to immune dysregulation, which can cause even further leaky gut problems, can cause even further low thyroid hormone production, and increases the amount of chronic inflammation that goes on. How about chronic inflammation and its effects on the adrenal gland? Whenever there is an inflammatory response from an infection, from allergens, from trauma, or from any other cause, your body secretes cortisol to help with that response. Cortisol is your main adrenal hormone. Without this counter anti-inflammatory response, the unchecked inflammation can destroy your tissues and cause a lot more damage, disease, and maybe even death. So your adrenal glands and cortisol are your first lines of defense to stop chronic inflammation. But though high cortisol levels make you feel good in the short term, they can cause problems such as high blood pressure, puffiness in the face and hands, fat around your midsection, sleep disturbances, irritability, and even insulin resistance if they stay high for too long. So your adrenal glands are working all the time to keep inflammation under control, but they can only do it so long before it starts to wear out. So what are the effects that inflammation has on the thyroid gland? Researchers have found that people who have subclinical hypothyroidism. Subclinical means that it is not bad enough to be treated yet, and hypothyroidism means that your thyroid gland is not working to its maximum. This is shown by a blood marker called TSH, thyroid stimulating hormone, and when your TSH level is above 4.2, what that means is that your hypothalamus and pituitary gland are shouting at your thyroid gland saying, come on, produce some more thyroid hormone, but it can't do it. So researchers found that people who have subclinical hypothyroidism have a higher level of C-reactive protein, which is another blood marker that is thought to be the predictor for heart disease risk. In addition to C-reactive protein being higher, insulin levels were also found to be higher in subclinically hypothyroid patients. So when you have a problem with your inflammatory markers such as C-reactive protein, you're also going to have problems with your insulin levels. So when these researchers looked at the thyroid gland and in relationship with inflammation, they concluded that the resulting low-grade inflammation associated with fasting high blood sugar levels may be a predictor of later insulin resistance in patients with subclinical hypothyroidism. Another extremely common hormone imbalance that is associated with inflammation is estrogen dominance and what is called PCOS. And PCOS stands for polycystic ovarian syndrome. Aging alters the estrogen effects on the inflammatory blood markers in women. And in a study in 2012, this group found that there was a positive association between increased estrogen receptor activity and the pro-inflammatory effects on estrogen. In other words, when women get older, the amount of estrogen that they have in their body increases the amount of inflammation that they have. So women who are in estrogen dominance, which means that there is too much estrogen compared to the amount of progesterone that they produce, increases the amount of inflammation that they have in their body. Different researchers in 2012 looked at the relationship between a leaky gut syndrome and inflammation, and that effect on the PCOS. The researchers suspected that unfriendly bacteria in the intestine created inflammatory molecules that leaked through the barrier between the gut and the bloodstream. And these inflammatory materials caused the immune response to react and for inflammation to result. They discovered that when the immune system was activated, it interfered with insulin receptor function. In other words, the insulin receptors started to downregulate or become resistant to the effects of insulin. And this prevents insulin from doing its job. And this causes a condition called insulin resistance. So when you combine the inflammation of estrogen dominance with the resistance to insulin, you create a situation where polycystic ovarian syndrome becomes very, very likely. And these two studies in 2012 show that you put these two problems together, women are going to have even further problems with inflammation that need to be addressed, but also can be reversed. Well, how about inflammation and male hormone problems? There is compelling evidence that cytokines, which are the main inflammatory substances in the body, play an important regulatory role in the development and the normal function of the male anatomy called the testes. When there is too many of the pro-inflammatory cytokines found in the male, it has a direct effect on the amount of sperm that is produced. There is also anti-inflammatory cytokines, and they are implicated in testicular development. In other words, as you're growing up, if you have enough of the anti-inflammatory cytokines or a decrease in the amount of inflammation, your development as a man is increased. But if the more pro-inflammatory or the more inflammatory cytokines that are in your body and circulating through your blood, the less likely you are to produce enough sperm. And this is a big problem over the last 15 or 20 years that really nobody is addressing. Inflammation also has a huge impact on your ability to create detoxification within your body. Toxins are at the root of many of our common illnesses, and detoxification can restore your body to health. And so further avoidance of toxins can maintain good health without any kind of medical intervention. When toxins build up in your body from ingesting the actual toxins or by eating too much of any type of food, what occurs is what's called general toxemia, or you're just becoming toxic. Inflammation is created to protect your body from the toxins, and is the underlying theme of most cardiovascular diseases, cancer, arthritis, and many other types of diseases. We have spent the last 50 years trying to decrease the inflammation due to toxicity. But recent research has found that anti-inflammatory treatments make no logical sense, even in rheumatoid arthritis, because unless you get rid of the toxins, the inflammation is going to continually stay there, even if you try to get on top of the inflammation with medication. Detoxifying by removing the source of the toxins using a plant-based nutrition plan is really the only sound solution to getting the toxins out of your body and decreasing the inflammation for good. So what are you going to do next to decrease your body's inflammation? We suggest you work in all 4 areas of functional health recovery. We want you to work on your attitude, increase your healthy lifestyle behaviors, eat more whole food nutrition, and move. We can help you get your life back by creating a better environment and decreasing the amount of inflammation in your body. Remember, we are here to help you. So do you have any further questions about decreasing your body's inflammation? If you haven't filled out your personalized functional health recovery assessment online yet, click on this provided link, My Personalized Assessment, and request your unique, encrypted, HIPAA-compliant link to uncover the one thing that will help you to decrease your body's inflammation right now. Once you have filled out your assessment, our health coach will contact you to set up a time for you to go over your assessment results with a doctor for free. There is no obligation, and your results are completely confidential and will never be shared with anyone.